I've told you before, I've published a number of studies in various areas. In this particular area of silicone, of breast implants, because there's various types, et cetera. I and some colleagues have published several studies, and I'm going to share some of those with you. So let's get going. Okay. In silicone breast implants, the silicone type, not the saline, a significant component is silicone, which is really silicone, as I explained last time, is like saying wine. Well, there's red wine, there's rosé, there's white wine, there's all kinds of different wines. You have to specify it because silicone is a very general term. So it's polydimethylsiloxane in this case. And it's not to be confused with the chemical called silicone, because again, that's SI is on the chemical table. In addition, the issue with this is that during the manufacturing, normal manufacturing process, not unusual or anything, they use platinum in this part. So it's a part of the catalyst. And so there's a risk of platinum toxicity. And there were also traces of lead and zinc in the implants, but in the regulatory world, this was a permitted amount. So let me go further here. And these were first marketed in way back in 1662. There's a problem of a cancer type. It's called anaplastic large cell lymphoma. And these patients are a particular subset of silicone breast implants. We reported 28 years ago in 95 that silicone breast implants reduce NK cell activity in patients that can lead to cancer. And so, I mean, these were published in medical journals, and so this has been known for almost 30 years. So this was brought up, and this is from a study in 2021. So brain fog, hair loss, fatigue, chest pain, sleep disturbance, gut issues, headaches, chronic pain, autoimmune diseases such as fibromyalgia, lupus, rheumatoid arthritis, scleroderma are all known in these patients. Now, in 95, Dr. Brautbar and I proposed the causal relationship between implants and disease. We showed that they actually cause disease. And what this meant is that silicone implants sweat, releasing silicone particles. And these particles can end up inside the capsule. The capsule is the scar tissue that forms around the implant and migrates into the surrounding tissue. And I'm going to show you not only silicone, I'm going to also show you saline implants. So you get the full picture of both. This is a study completed 2 years ago of 389 women. 284, 98.8, 99% had silicone particles present in the tissues, indicating the silicone gel bleed that here in 95 we already showed. So this is showing that nothing's changed. Okay, so in almost 87% of the women, silicone particles were found outside the capsule, in the tissues surrounding the capsule or in the lymph nodes, indicating that these migrate. So then the issue became that in a total of 6 women out of this group had the cancer caused by silicone implants. Only 1.2 had no silicone detected in any tissues. So 99% of the women had silicone gel bleed, and in almost 87%, these silicone particles were found outside the capsule. So here's another study, and this one showed from Dr. Teuber and his group that 35% of women with silicone breast implants had measurable amounts of anti-collagen antibodies, higher levels than observed in any other autoimmune disease, similar to levels found in chronic rheumatoid arthritis. Well, despite this evidence and the fact that 50 to 70% of the patients who developed symptoms or disease processes in association with silicone breast implants recovered after the implants were removed, there were still a lot of people saying, no, that's silicone implants doesn't say that. But what is strange is that epidemiological studies are needed for risk assessment and not for what caused it. For example, the patients who had Legionnaire's disease, that didn't require an epidemiological study. So this is giving you, and you can see at the bottom, this was published by Dr. Brautbar, Dr. Verjdani, and I back in 1994. So what are the immune functional impairments in patients with clinical abnormalities and silicone breast implants? So there's been a number of reports describing the occurrence of connective tissue disease, in other words, autoimmune disorders, and after the implantation of silicone. Scleroderma, systemic lupus, erythematosus, polyarthritis, Sjogren's syndrome. And these became clinically relevant after 2 to 21 years after the implants were put in. So, and if you do normal laboratory tests, these show that everything is fine, okay? For platelets, liver, and renal function, urinalysis, thyroid function, enzymes, immunoglobulins, all these. And we showed this, if you look at the bottom, 31 years ago in 1992. So the study we did was to evaluate the immune function of 40 patients between the ages of 28 and 64 who'd undergone surgery for breast implants for a period longer than 10 years. And then we compared them to 40 women with the same age as this 40. So what we showed is abnormalities in T helper suppressor ratio, increased autoimmune disorders, as well as increase of production of immune complexes. What are immune complexes? That's when antibody and antigen form together and cause inflammation. Well, again, the study is mentioned below, and we published it over 30 years ago. Now, here's where we come in with the NK cells. These are specialized cells that like to kill cancer cells. And they also work for acute and chronic viral infections. So what we found is that NK cells, there's less of them, and of those that are there, they don't function as much. They're not doing much, they're sitting around. And so this was related to a study published by Dr. Silverstein, who showed that patients who had breast implants developed breast cancer and had a higher percentage of invasive lesions. Again, 1992. Now let's talk just for a minute about Asia. This was what it means is autoimmune inflammatory syndrome induced by adjuvants. And it was introduced by Dr. Schoenfeld in 2011 in this study that's mentioned. So what is that study? It showed that basically what adjuvants are pharmacological or immunologic agents that is a little amount has a great deal of effect on the immune system. Okay. So what kind of patients get this Asia syndrome? Not all with silicone breast implants. I'm just bringing it up in case people ask, what about Asia syndrome? It's found in post-vaccination symptoms, in myofasciitis, in Gulf War syndrome, and in sick building syndrome. What is that? Mold and mycotoxins. And number 5, siliconosis. And we're going to talk about siliconosis. So this is silica, silicosis, and autoimmunity. How does it work? These silica particles go to the lungs and are deposited in the alveoli, the smallest parts of the lung, and then they're ingested by macrophages. Macrophage, 2 Greek words meaning large, macrophage, eater. These are large cells that come and engulf these particles and initiate an inflammatory response. And this stimulates fibroblasts, a type of cell that are fibers, to proliferate and produce collagen. And then silica particles are encased by the collagen, and this causes fibrosis and nodular lesions characteristic of this disease. And this, by the way, this was a study written by Dr. Ken Pollard, and he and I have published other studies together, but this one was just by him. And so having said that, silica contributes, and in this study, he states this, that silicon contributes to a number of autoimmune diseases. And again, we just mentioned them, but lupus, rheumatoid arthritis, systemic sclerosis, and anti-neutrophil cytoplasmic antibody. It's called ANCA. That's the acronym. Related vasculitis. This is where you get Raynaud's phenomenon, colds, hands, etc. So here, and I showed these last time, here's a 34-year-old female presenting with breast implant illness, principally with pain in one breast on the left side. So they took the whole breast and the capsule, that scar tissue. This is a silicone gel implant, and they took out the whole thing. Now, here is a 47-year-old female with both sides, and they removed these silicone breast implants. The capsule is on the right, and it was removed so you can see. Do you see that implant? How cloudy it is? They're normally icy blue, kind of like the background, or little lighter blue than the background on the slide. But they're an icy blue color. Look at it now. A cloudy kind of color, kind of a beigeish. And here's one with a saline implants, both of them. Again, do you notice the cloudiness, especially on the right side? And here's the capsules that were removed so you could see them. And again, this is saline filled. And here is the front before and after complete removal for saline-filled implants at 6 months. And this is the last picture you're going to see. What do you see on the right? On the right, what are the, no, those aren't ants or anything like that, as I was asked one time. Now, what do you think that is? Mold. Yep, mold. So, what do they find inside the implants when they take them off? In 200 women with breast implants that were removed, in 2/3, 68.5%, they cultured them and were positive. What did they find? Aspergillus, a mold, and bacteria. This is a study published last year. We've been saying it since 30 years ago. So what a woman shows up in your office and she has implants and she has symptoms. The first thing you do is you recommend explantation, because sometimes in some women that solves the problem completely. I also recommend something, because I've seen thousands and thousands of these patients over the last 30 some odd years, obviously having published 23 studies. I test for vitamin D3 levels. You want it between 50 and 80. You want immunoglobulins, immunoglobulin A, E, M, G, and G is divided into 4 subclasses. So don't just get plain G. Get G, immunoglobulin G, and the 4 subclasses. And get MyMycotoxin antibodies. And lastly, an autoimmune panel. And I recommend this immune panel. Now, if you noticed in the previous studies, the authors that I wrote with, here's Dr. Vojdani. Well, Dr. Vojdani has had a lab for a long time, and he's done, he has published over 200 studies. So I recommend his autoimmune panel, not Quest, LabCorp, and whatnot. I recommend the best lab for autoimmunity, and that's immunosciences.com. And the panel number is 2011. One of the questions is, aren't people told about this? Why do you think? And we'll talk about that in a minute. Remember the first rule of toxicology, and you've heard this in many of my webinars and lectures at medical conferences, etc. The first rule of toxicology: get the patient away from the toxin or the toxin away from the patient. Explantation. Okay? Ideal levels of vitamin D3 are 50 to 80. If you get one, the lab will say 30 up to 30 or above is normal. Okay, that's what they want to say. But honestly, you need 50 to 80. To treat the mycotoxins mold, go to MyMycoLab, and at the top of the website, click on video, and then you get all my webinars and watch the one I did on treatment, a paradigm. And that will help you sift through a lot of the symptoms, because some patients with silicone breast implants will come with these type of symptoms. Others with these type of symptoms, others with these type of symptoms. And we've got to look at autoimmunity. Now, if the test from Immunosciences Laboratory 2011 shows elevated immune complexes, what is an elevated immune complex? It's an antigen antibody complex, and it's kind of like putting a cat and a dog in a bag. Maybe that's a poor analogy, but you know what I mean. It's like they're fighting, and what do they cause? A lot of inflammation. Now, the treatment of any of the autoimmune markers, this is more complex, because remember, this is autoimmunity. However, there's one important thing about autoimmunity. And this is another, you find me saying this in my lectures and in my webinars. Find the cause, remove the cause, repair the damage, and the patient is fine. And I've showed you slides with patients with scleroderma, rheumatoid arthritis, mast cell activation syndrome, etc. I showed you the before and the after, where they're completely normal again, and the MyMycoLab test results, the before and after. Now, autoimmunity is a result of inflammation. What happens if you remove the implants and the cause of inflammation and you treat the inflammation? What do you think is going to happen with that autoimmune marker? Yes, it may decrease. And if it does decrease, that is what you're looking for. And I've treated, imagine, I published in 92. So I saw patients starting in the late 80s. So, I'm old. See the color of my hair. So I recommend my late friend and colleague's product. It's called Dr. Steve Sinatra. A great man, and now his son Drew is a doctor as well, and he's a wonderful doctor. It's called Omega Q Plus Max. What do you get in one capsule? You get curcumin, anti-inflammatory, resveratrol, anti-inflammatory, coenzyme Q10, and omegas, all together in one capsule instead of taking 4 different things. Got to give these patients magnesium. Magnesium is involved in more than 350 enzymatic processes in the human body. We all need to take it, but especially these people, these patients who are suffering. And vitamin C. Who wrote all the stuff on vitamin C? Dr. Linus Pauling. Dr. Pauling won the Nobel Prize twice. So I have a tendency to listen to what he wrote. I'm not listening, accept what he wrote. And he says, use vitamin C because of all the inflammatory processes, but also the immune complex. And it's a great, and we can't store vitamin C, and we don't make vitamin C. So 2,000 to 3,000 milligrams twice a day, and if they can tolerate more, I would give it. And then and for those of you who have not seen my videos, I show you actual cases of total healing. I mean, they were healed of autoimmune disorders. And I show pictures before, during, and after. So it's not, I don't know, a trick shot or whatever they do on the internet with photographs and stuff. I don't know that. Okay, so let me, now I want to tell you that I've authored or co-authored 23 published studies on breast implants and breast implant illness. If you have any questions, it's very easy, write me. My point here is to teach. And all the things that I do, I don't charge for things like all these so-called experts, sign up for this summit and that summit, and we'll teach you all these things. If they're really experts, where are their publications? Where did they actually, what makes them an expert if they never published anything? That's a good question. So my email, immunedoctor@gmail.com. And here is the studies, 23 of them. By the way, some are chapters. So Let me put my email address back. So this is the key to silicone breast implants. Remember, as I showed you, about 2/3 of these women will get better just with the explantation. It's the others that you have to worry about. And some of them get well, and then 2 months later, 3 months later, they're back in your office because, you know, they say, I thought I felt well. I felt much better, but I'm still not completely well. So those are the ones, by doing the testing early on, you know what you're dealing with. Don't wait till they come back, or you may have lost them to some plastic surgeon. Now, why don't plastic surgeons do this? Okay. So let's take bovine hormone, VHT treatment, which is given to dairy cows, and they produce 22% more milk. Tell a dairy farmer that he's not going to be allowed to use that hormone, and his income is going to drop by 22%. What do you think he's going to say to you? Plastic surgery, don't forget, is not insurance and things like that. You've got to put the money down. So it's very lucrative, and it was a lucrative thing 30 years ago when we published these studies, and it still is today. They're not going to tell you, look, I have to let you know that there's been some studies published that say this and this and this. And as I showed you, I gave you the references for all these studies. It's not my opinion. Like on the internet, all these so-called experts, they're giving you their way of doing things without any medical or scientific evidence behind it. This is medical and scientific evidence. So that's what you've heard today and seen today on this webinar. And by the way, this is recorded, so we can share it with people who couldn't be on this. Anyway, do you have any questions? Oops, let me go back. On the chat part. Oops, here I go again. I did keep pushing the wrong thing. Excuse me. Here I have a question. Well, thank you for the compliment. I'm being complimented for being straightforward and telling you exactly which lab, et cetera, et cetera. Yeah, because there's so much misinformation on labs and everything else. So hopefully you learned something, and you'll let others know that there is treatment for this, and it is successful. That's the main point. Not just keep treating, but actually curing these folks. So, Andrew Campbell, MD, saying good night to you all. Okay, wait, one question here. Would you follow the same treatment protocol for anyone with an autoimmune disease, or is this specific for breast implant patients? No. This discussion was on breast implant cases, but it's the same. And when I say breast implants, it's both silicone and saline filled, as I showed you in the actual photographs. So there is no difference between one and the other. They all cause a reaction. What is the envelope inside, whether it's silicone or whether it's saline? The envelope is still silicone. Okay. The treatment for autoimmune diseases, and I've written a lot of studies on autoimmunity, and I'll be happy to don't go to PubMed and pay $40 or whatever they charge today. Just ask me for it. I'll send it to you. Okay. Would I follow the same treatment protocol? It depends on the patient. What was the trigger? Remember, find the cause, remove the cause, repair the damage. What was the cause? Was it an implant? Was it a toxin like mycotoxins? And so it depends on each one. And I discuss some of that in the treatment protocol that you can get by going to MyMycoLab.com. The top, there's various things. Click on the one that says video, and up come my videos and webinars. Actually, I got into molds from the saline and silicone implants. Rashes. Is that type of mast cell response? Okay, that's a good question. So again, go to the MyMycoLab.com, click and go to mast cell activation syndrome. I gave a class on this in a medical school in September or October in San Francisco. And we're actually MyMycoLab, not me. I'm just their medical advisor. They're doing studies with Tufts University School of Medicine and with Washington University School of Medicine on mast cells. So in the photographs that I give, you can see the mast cell skin rash. And a few months later, the same person, it was a woman and it was her legs. Oh, I mean, she had it all over her body, actually, but I'm not going to take pictures of everything. I just want, I did, but I don't want to show them on a webinar. So yes, you can see the pictures, the before and after, the labs before and after, etc. Do I recommend measuring total IgE and IgE whenever my MyMycoLab panel is done in case there's low? No, because if it's low, you're going to know about it. This person is going to know about it when they're children, because as low IgG is going to give them more frequent colds, infections, and all that. And they're going to be treated by a pediatric immunologist. 7% had mold. How many of those patients had saline implants? You'd have to read the study, but it's not 7%. If you want, I'll go back. You remember what slide it was? I don't. But it was like 60-some%, like 2/3, not 7. Oh, here. So it was 68.5%. So anyway, folks, there's a lot more to silicone breast implants and saline implants. Really, in my experience, and I'm talking thousands of women, I've seen women that you've seen in movies, you've listened to their songs, etc. And I've seen just, you know, the lady that lives down the street from you, etc. The point is that anytime you have an implant that causes an immune reaction, an adjuvant reaction, you're going to develop problems. And as you saw, there's a lot of women with silicone breast implants who have medical problems due to these implants. All righty, folks, I'll let you all go now. Have a good rest of the evening, and all the best to all of you. Bye-bye.